So looking forward into this year, of which we're a number of months through already, what are our key priorities? And you'll remember back to the slide that had the values on the left and the priorities on the right. So this is some of the headlines in relation to the priorities that as a board we believe are important for the organisation to focus on. Clearly, we need to maintain and improve patient safety and some of our quality indicators in line with national standards. There is always improvements that we can make, and we recognise that. And we look to learn from our complaints and also our compliments to make sure that we are moving forward as a learning organisation. Many of you will know that the organisation this year and going forward in subsequent years has a major financial challenge. Now, across the health service, many organisations are suffering the same challenges, and we are not alone in that, and we have a serious issue that we're tackling and gripping very hard. We're aiming for an £18.7 million worth of savings, and you'll see it's quality and cost improvement. My focus is, if we focus only on the money, the quality suffers, and if we focus only on quality, our service becomes unaffordable. So we have to do both at the same time. And some of the changes we're putting in are very much focused on improving quality as well as cost improvement. And at the same time, we absolutely have to focus on improving the patient experience. Our staff, despite their best endeavours, often don't communicate as well as we would want them to with our patients, both through their administration prior to coming in and at discharge. We recognise we have to improve that. And as an indicator of improvement, we're very keen to reduce the number of complaints we receive each year. And moving on, from my perspective, happy, well-trained, well-supported, well-supervised staff provide care for patients, and we have happy patients as a result. So we need to improve the rate of appraisal and making sure that individuals have training and development plans that will help them to continue to improve the way in which they're delivering services. And we have to also focus on reducing sickness absence. And we see patterns at times of different times of the year, but also at different times of stress and morale within the health service. And it's an area that is a constant focus for our organisation as well as others. As I talked about, we have the progress over the next year in relation to the redevelopment of the St Heliers site, and you'll soon see a very large banner signalling that this work is happening, which will hang at the front of the hospital. But also you may have seen recently what looked like drilling holes, if we were starting to see if we could find oil under the St Helier car park. That was to test the strength of the ground to accommodate the multi-storey car park, which is under discussion with Sutton Council at the moment. And as I said, we'll continue to invest in our capital schemes. Now, I just want to dwell for a couple of minutes on the transaction process. I referred to it earlier. Many of you will know that our route to foundation trust status, because of our problematic financial plan, is going to take a different route. The board last December took the decision that we needed to seek other partners for the organisation, and we established in January and February a transaction process in line with the Department of Health's guidance to look for partners for both Epsom and St Helier that would enable our services, our hospital services, to be provided within a foundation trust context going forward. You've got some dates there that show some key headlines. We're on track at the moment in terms of the timetable. We expect to receive bids from 3 organisations on the 11th of November. We'll then go through a process of reviewing those bids to hopefully get to a decision in January, where we have preferred partners for the respective components of our organisation. The timetable then is likely to be across the rest of 2012 preparation for demerger, with a January 2013 deadline. That's still subject to Department of Health approval, but that's the broad timeline that we're looking at. And clearly the engagement with staff, public, representatives of the public, other stakeholders, MPs, etc., continues and will continue during that time, and many of the team have already spent a number of evenings talking through how this works with our partners locally. So I'll leave it there. I just want to make two observations. What's impressed me and made me feel very privileged to be the chief executive of this organisation is the commitment of all of our staff, but also of the people locally. And what I'm very keen to do is to ensure that we can resolve the uncertainty that has hung over the organisation for many years now, and resolve the sense of false dawns that the organisation has had, and to try to get to a situation where we have a degree of certainty. It won't be to everybody's liking. Not everybody's going to be happy about how the future looks. But my sense is that if we can secure our services within the context of a foundation trust environment, we have a better chance of securing long-term services on each of our sites. And before I hand you over to Christian, I want to make a final plug. This afternoon I had the flu jab. It didn't hurt. There'll be a photograph soon of me smiling after I'd had it. I did actually have the jab, as opposed to a photo that was just mocked up looking as if the chief exec was having the jab. And on a serious note, flu is a killer. It is something that is often largely avoidable. The vaccines do work, they don't hurt, they have side effects, but not for everybody. So can I encourage you to have the flu vaccine, because that will help to reduce the spread of flu across this winter. So that's my final plug. I'm sure I'll have plenty of things to say about other things. And the other thing I would say is around infection control. I had the hand washing test, and I succeeded. I passed the test. So again, I would encourage you to make sure you pick up the leaflets around infection prevention, because it's everybody's business, yours and mine.